We're going to get started as soon as we get a quorum, so just hang on. Morgan is going to put a sign up sheet down here on the podium. So if you wish to speak to a bill, please sign up and sign up for the bill you're speaking to. Yeah, we have a quorum now, and let's go ahead and call up HB 1264, Representative Ron Stevens.
I think I'm on. Yes, sir. I appreciate that. Thank you, Mr. Chairman, members of the committee. House Bill 1264 is an alternative to discipline program primarily for our nurses. House Bill 1264 will authorize the Board of Nursing and the Composite Medical Board of professional counselors, social workers, and marriage and family therapists to establish an alternative to discipline programs to provide monitoring for these rehabbed and impaired healthcare professionals. Georgia currently has programs for of this sort for physicians, dentists, and pharmacists. And for pharmacies, we call that Pharm Assist. And that was placed into effect years ago. Georgia is one of only 7 states that do not have an alternative discipline program for licensed professional nurses. We've got Alaska, Georgia, Missouri, Nebraska, New Hampshire, Utah, and Wyoming that are the 7 states that do not. If you'll notice, all of our southern states have an alternative. These programs enhance patient safety through early detection, intervention, and contractual monitoring for those nurse practitioners that are negatively impacted. Alternative to discipline programs provide assurance of safe practice and maintenance of nursing standards while simultaneously supporting the nurse in his or her successful completion of the treatment program, rehabilitation program, and maintenance for a sustainable recovery program. Georgia's being impacted by a national shortage of nurses. This program will bring us in line with the other southern states. This program allows treatment without the person losing their, without nurses for their, kicking them out of the profession for their affliction. This is not necessarily for what might be drug abuse, but it's also for someone who might have a mental illness that needs treatment. And Mr. Chairman, this will do that. And again, the other 3 major professions have it. And in light of the massive shortage we've got in nurses, this will go towards helping keep this sustainable.
Okay, are there any questions? Okay, I can tell you that I'm familiar with this in the dental world. When I was president, I saw a few folks go through this program and they came out the other side and a productive dentist once again. You know, a habit, dependency, whatever can happen to anybody due to all kinds of pressures, whether it be from practicing or something with a family or whatever. So it's very important. And I appreciate you bringing the measure. And I do have a question, Mike 22. I'm not sure who that is. Me, Mr. Chairman. Oh, okay. Go ahead. Representative Pete.
Thank you, Mr. Chairman. Chairman Stevens, thank you for bringing this. As you know, my good friend, I've had a long career hiring nurses and caregivers in this state and problems. And so we need a route, especially today. 35 years ago, we didn't have a shortage of nurses like we do today. And it's just continues to, we continue to suffer with that to this day. So we need, I've seen nurses turn around in the same way, maybe without this kind of support, to where they come back, they're as effective as ever, they're as safe as ever, they're as competent as ever, and they overcome obstacles that have been in their way that may oftentimes relate to issues with their marriage and a multitude of things I've seen over my career. So I appreciate this good measure and support it strongly. Thank you, Mr. Chairman.
And if I can just answer that or respond just a little bit, short of this measure, Mr. Chairman and members of the committee, there's a barrier, if you will, that might prevent a nurse from coming up and say, I've got a problem. And of course, that is not what we want in the healthcare field at all. And this, of course, I believe will remove that barrier so that the person who has a problem will be more likely to step up to get help.
Thank you. Seeing no more questions, do I hear a motion? Second. All those in favor say aye. All those opposed? Okay, we have House Bill 1264, LC 540353 do pass. Congratulations.
Thank you, sir.
All right. Next up, why don't we hear HR 1133 by Representative Mitchell? You can do it from there if you'd like. What number are you, Billy?
Let me catch my breath here. I'm number 4,
Gotcha.
Mr. Chairman.
Gotcha.
Thank you so very much. This actually is a simple measure. Was passed on to me by the Georgia Kidney Foundation. And what this measure simply purports to do and encourages us to do is to urge the United States Congress to introduce the Kidney Patient Act into a law. For your information, the Kidney Patient Access to Technologically Innovative and Essential Nephrology Treatments Act, it is called. What is happening is the proposed changes to Medicare would exclude payment for phosphate lowering therapies from Medicare Part D to the ESRD, or end-stage renal disease payment system, which simply would not be available to them until they get into the end stages of the disease. This bipartisan legislation, I must add, by Georgia's own Representative Carter, Republican, Representative Custer, Representative Miller from Illinois, a Republican, and certainly Representative Sewell, bipartisan legislation, and we would join the overwhelming majority of states that are encouraging the Congress to act on that bill, which would have a disproportionate effect on lower income consumers.
Any questions from anyone on the committee?
Mr.
None.
Mr. Chairman, as a member of this committee, is it appropriate that I make a motion?
Of course you can.
I was, looking at the bill, I thought that it was a great bill. But, after presenting it, I said, man, what a great presentation. And so I do pass.
You're floating with, right, you're floating with having your mic turned off. You know that. Do I hear a second? All those in favor say aye. All those opposed? Okay, the resolution passes. House Resolution 1133, that's LC 1280186. Congratulations. All right. Let's up now, HB 441, Representative Dempsey. Now, I would like to remind the committee that we actually passed this bill last year. Since it did not cross over, it's remitted back to the committee. And I understand that the lady has a slim down bill this time.
We do, we
Yeah.
do, we do. Thank you, Mr. Chairman. Let me get this chair under me, actually. Well, it won't move, so I'll just have to go with it. Good afternoon, Mr. Chairman and members of the committee. Thank you for letting us come back after having making some improvements to HB 441. So we're once again looking at it, and it authorizes and regulates the practice of teledentistry in Georgia by Georgia licensed oral health care team members. It works with the current general supervision law for hygienists to work outside of a private practice setting in both safety net settings established in 2017 and other locations. This bill will help to create a network of dentists within Georgia that allows providers to share workforce and gives Georgians better access to oral health care. The premise of the bill is that while teledentistry encounters are a useful tool for triage, and consultation purposes, as well as expansion of access, dentistry is still an inherently tactile practice. If there's a problem, ultimately the patient still has to see a dentist and receive treatment. From a patient safety perspective, this bill ensures that all patients know the identity of their dentist and how to get help, be it from the Board of Dentistry or even a private attorney, if the dentist is unresponsive to their concerns or the patient is harmed by the dentist or their staff. So when we look at the changes that were made, the word auxiliaries, the Georgia Dental Association heard the concerns of the Georgia Hygiene Association, Dental Hygiene Association, and separated the hygienists from expanded duties dental assistants. It denotes their education and licenses. The Georgia Dental Hygiene Association had concerns that if Georgia required a permit to practice teledentistry, less providers would participate due to paperwork and fees. From our perspective, the permit regulates teledentistry, ensuring that only Georgia licensed dentists are practicing teledentistry. The solution to this is registration, offering a box to check on the application or reapplication of a Georgia dental license would help to keep track of who is participating and help to maintain a standard of patient safety without an additional fee or additional paperwork. Performing x-rays under more direct supervision standards. This was a valid concern of the Georgia Dental Hygiene Association and one shared by members of the dental community at large. This part of the bill has been removed, allowing for the same standards that exist in private practice as well as in safety net settings. The mileage carve-out. As Georgia continues to work through our distribution challenges with oral health care providers, there was concern for the communities who are not within 50 miles of a dentist for the referring dentist requirement. The suggestion of a carve-out for those counties who do not meet that requirement was made and is reflected in lines 60 through 66. Coronal polishing. The last version of this bill included a section which allowed for expanded duty dental assistants to perform coronal polishing. That has been removed. Mr. Chairman, that is kind of the outline and the changes. I have Teresa Garcia Robinson with the Georgia Dental Association here with me, and if there are any questions from the committee between us, we'll do our best to answer them.
Number 26, Mathiak, Representative Mathiak.
Thank you, Mr. Chairman. Is it not true, Chairman Dempsey, that just this morning we heard from Chairman Penny Houston, and her retirement is going to be really looking at dental hygiene and health in South Georgia. So this is a perfect segue for her to continue her endeavor in the political world in helping her constituents and people. So I'm in favor of this. Thank you so much for bringing it forward.
Thank you, Chairman Mathiak. Well noted. I mean, I do think that I hear from Chairman Houston more than anyone about the challenges that she faces, and particularly in the disability community for our young adults and children with Down syndrome and other developmental disabilities. It takes some very specialized care, and there are not many people there to actually do that, and it can be very far from the home of that individual. So I think anything we can do to help our rural communities and our dentists who are most anxious to serve and our hygienists who are most anxious to participate find ways to take care of their patients.
Mr. Chairman, at the appropriate time, I'd like to-
I've got some more questions. We got some
Okay.
people signed up.
Thank you.
Thank you, though. Representative Petrie.
Thank you, Chairman. Chairman, you just hit the nail on the head talking about individuals with developmental disabilities. I've got one of the few folks in Savannah around that provide specialized care to individuals with developmental disabilities. Of course, that's a Medicaid issue too, which we've been working on for years to improve through health appropriations, our reimbursement rates. We got folks coming all the way from Waycross, driving 150 miles to get care because they can't get it. So having been in long-term care my whole career, again, speaking to my background, skilled nursing facilities and a multitude of other, individuals with developmental disabilities that are in community living arrangements and other types of settings. It's very difficult to get them dental care. So anything we can do to try to expand that is a good thing, at least until we fix the current situation with a dearth of dentists. We're working on that, by the way. We've got a new dental school coming in Savannah, I'm proud to say. So, but this is, again, another effort for us to share. We're trying to make sure that everybody has access to good dental care, and I support the measure. Thank you.
Thank you, Chairman Petrie. Also, the population of elder care that you've been working with, I would say too, to transport someone can be very disruptive in their life and very hard and expensive. So if there's someone who can go on site, check out that mouth first and see what the next step is. We have helped not only the patient, but to sort of maximize the time to take care of them in a quick way.
Yeah, go ahead.
I was just, to the chair lady's comment, to the chair lady's comment, can you imagine moving someone from a skilled nursing facility on a stretcher to see a dentist? It just doesn't make sense. And so, yeah, anything we can do to make it easier to provide care where people live, especially those that have ambulation issues, et cetera, is a good thing. So we see eye to eye, like usual.
Thank you.
Thank you.
Representative Douglas.
Thank you, Mr. Chair. Madam Chair, I am all in favor of the bill. I just had a few questions that I wasn't clear about. So with this, the doctor will be able to go on site wherever the person is located and perform these procedures. Am I correct?
The hygienist will be
Hygienist,
there.
yes.
But the doctor will be the supervisory mode. So it's not a hygienist just being there alone.
Okay. All right. Follow up, may I? Will they be able to perform like a cleaning or something like that on the spot?
They will.
Okay. So not root canal, right?
No,
I'm just kidding. I'm just kidding.
drugs are not really involved in this.
We can arrange that for you, Representative Douglas. We can do that this afternoon. Okay, Representative Jones.
Thank you, Mr. Chairman. Madam Chair, real quick, just a couple things. Lines 60 through 66 that you talked about in terms of that referral. I just want to make sure that I'm understanding this. So if there's a dentist in Forsyth County where I live and there's a patient in Ware County, are we saying that a dentist who has a physical office in Ware can authorize the dentist in Forsyth to practice teledentistry down there? I'm trying to understand the practical.
It's not authorizing, it's having a relationship.
Our relationship, I
between
apologize.
the two dentists to
Right.
make sure that if something happened closer to the referring dentist.
Right.
That patient has a place to go in case of an emergency that's much closer to them than the person that the provider that the hygienist is working for. I apologize.
Okay, so I just want to be clear that I understand. So the Forsyth dentist
Mhm.
is practicing teledentistry in Ware County, but because of the fact that there's a relationship between the Forsyth dentist and the Ware County dentist, the Ware County dentist has a physical office according to line 60 to 66,
Yes.
has the relationship. And then that allows the hygienist to go in there physically and be able to perform based on teledentistry.
Or if they were outside of a dental practice, that though I'm trying to keep up with where we are,
That's okay.
the Forsyth
Forsyth
dentist
and Ware.
and Ware. So if she's closer to the Ware County dentist or he is closer to the Ware County dentist, they're able to take that patient there if there's an emergency. Again, this is just a patient safety issue, making sure that there is a dentist close by
Okay.
who can mitigate an issue if there is one.
Okay, so maybe I misunderstood then.
Okay.
So if the patient's in Ware County, is where does the services the hygienist is providing, where's that occurring?
It can occur in really anywhere. I mean, the hygienist doesn't have to be, that is not specified. You don't have to be in a dental office.
Okay.
If that patient, they're hygienists that are meeting people elderly patients that are having this work done in their homes potentially. But again, they're authorized by a dentist who's in Forsyth County to go out and do this, but that Forsyth County dentist has a relationship with the dentist in Ware County. So if they're closer to Ware County and there's an emergency, they can get that patient to Ware County faster than they could get them back to Forsyth County. Does that make sense?
It does make sense.
Okay,
But for clarity, the Forsyth
Uh-huh.
County dentist isn't necessarily practicing in Ware,
correct.
but for the relationship he or she
That is
has
correct.
with the dentist in Ware County.
That is correct.
And then I'm sorry, would you mind another question, Madam Chair? Yeah. Then on line 67, where subsection D starts, that effectively through 85 is telling us what the person is authorized to do. Is that an accurate statement?
That would
So
be,
60 through 66 says who can do it. And then subsection little d tells us what can be done. Am I reading? And my apologies, I'm kind of getting up to speed on this.
no, you're fine.
Okay, is that fair?
That's
And then the last question I have, and again, would that be okay? Is one of the things that we saw, not to conflate education and dentistry, but I'm going to, one of the things we saw during the pandemic was this move to virtual education. And a lot of our teachers had not been, I'll say, trained on how to deliver virtual education. They had been trained on, I'll say, the Socratic method. They've been trained on the 1 to 30 in person. Is this is for my edification, is teledentistry, may it be for the dental schools, the dental hygienist schools, is this being trained? Is this part of their curriculum? So they're prepared to deliver services vis-a-vis, I'll say tele versus, I'll say physical?
So I will say, yes, they are, because these services are already happening. So if you look at the section online, starting at line 97, that is talking about what's happening in what we call a safety net setting that was established in 2017. This is an extension of what's happening in safety net settings where hygienists specifically are going out into the community and they are seeing patients that are in Title I schools. They're seeing patients that are in nursing homes. And so this is already being done in what we have been referring to as safety net settings, and that doesn't touch what's happening there. These hygienists are more than qualified. It also specifies at the beginning of the bill what type of qualifications you have to have. You have to have been a hygienist
I
for
saw
more
that.
than 2 years and have that experience. But these hygienists are already going out into the community and doing these cleanings in settings that are not a private practice. And so they are more than equipped and more than educated to provide this service for the community.
So I appreciate the clarification because I was worried about sterile fields and things like that, but it sounds very much like that is something that's taken care of now. And that is part of their curriculum in Georgia schools.
Yes, they are. This is just an extension of what's happening in these safety net settings.
All right. Thank you so much.
Thank you.
Representative Sharper.
Thank you, Chairman. You hit some things on the head. Thank you so much for being here. And it was a time where I had some concerns, about the bills, but I'm glad we were able to talk through some. And, I appreciate you doing that, being concerned about my concerns. And I was just going to hit about the nursing homes and places where they're already going out, making a difference. Me being a paramedic over about 35 years now, but me being in the medical community, I'm seeing this stuff happen in front of my eyes, which is great. So I just appreciate you bringing this, and I'm full support of it.
Representative Jackson.
Thank you, Mr. Chairman. Madam Chair, I was listening to it just like Representative Sharpton said, and I had some questions. These hygienists are trained and licensed hygienists,
They are.
and they are already doing this already, and we're just expanding the scope of what they can and can't do.
I would say the way I understand it, they can do this already. This authorizes the practice in a way to be able to expand on that and to be in contact with more people who actually do need the services. That's what I see.
If I could just add to that, during COVID, there was, the governor put out a special order and an executive order that allowed for teledentistry to exist. But when COVID-19, when those executive orders went away, so did the practice of teledentistry. This is just putting this back into effect the way that it was during the executive order.
So Dr. Hawkins can send somebody out and do teledentistry.
Good.
I used to be able to do that. Okay, we have someone to speak to the bill. Steve Tippins, would you come to the podium, please?
Thank you. Your Honor, if it pleases the committee, Steve Tippins with McGuire Woods. We represent the Georgia Dental Hygienist Association. I first want to thank the chair and thank the author and Miss Teresa here about bringing a substitute. There are many, many changes in the substitute that the dental hygienist appreciate and support. It is a better bill than last year's, but I would be remiss if I didn't raise three very brief points, which I have hastily prepared. First, the expanded duty dental assistants that you will read about in HB 441. They are only required to take 1 4-hour course to receive this expanded duty status. Current law requires dental assistants may only work under the direct supervision of a Georgia licensed dentist. HB 441 changes the scope of practice that these unlicensed and unregulated assistants would have to have and authorizes them to provide hands-on patient care without the presence of a dentist. Secondly, under the current law, which you just heard some testimony about, for the last 5 years, dental hygienists have been authorized to provide basic preventative dental services directly to the public in these safety net settings that you just heard about. Safety net settings include long-term care facilities, nursing homes, hospice, hospitals, family violence shelters, for example. 42 states currently authorize dental hygienists to provide such preventative care in these safety net settings directly to the public without an initial exam by a dentist. One of the things that even the substitute here, the HB 441 would do is roll that back. I understand the testimony a second ago about how this bill is expanding the safety net practice that we currently observe in Georgia law, but based on my understanding of the substitute, the thing that I would point out is the practice that has expanded under this bill would have dental hygienists more fettered than under the preventative care they offer now in the current safety net arrangement, which brings me to my third point. Having said all that, the association just received this bill this morning. That is their initial review after a cursory reading through the bill. We remain committed to working with the author and the dentist to find a teledentistry bill that is good for all patients in Georgia. We recognize the importance of dental health, and I would welcome any questions, or although I don't know that I would be qualified to answer them all.
Are there any questions? I will make a comment. The assistants have been taken out of this bill. The first concern. So that's gone. The second concern you mentioned is really what we're doing here is we're having hygienists work in an extended setting in a dental office somewhere where the dentist is not. So the teledentistry can occur. It is a sterile operatory. And so this really is a way to extend, especially out in the rural areas, the ability to people to go in, have their teeth cleaned, radiographs are taken, and then the dentist by way of teledentistry in an office somewhere else reads those x-rays, does the exam, talks to the hygienist. If anything else is noted, then that patient has made an appointment to see the dentist. So this is simply a way to extend the services to patients, especially in the rural areas. Okay. Any questions? But thank you. I appreciate your comments.
Appreciate it, Your Honor.
Do I hear a motion? Second? All those in favor say aye. All those opposed? Okay, congratulations. I always read the LC numbers. LC 520482S. Congratulations, Representative Dempsey. Okay, up next, HB 1046. Representative Clark. And this right now is a hearing only. So we have a lot of folks out there want to speak to this bill, and that's fine, but unless y'all can convince me otherwise, we'll do a hearing only on this today.
Thank you, Chairman. I definitely think we can convince you to allow a vote. I'm confident of that.
Well, my committee, I should say my committee, not just.
Thank you, Chairman and colleagues. Today I bring before you House Bill 1046, substitute LC 540366S. And this bill has two major parts. First, it authorizes the APRNs and PAs to order home health care services. Second, it authorizes APRNs and PAs to sign death certificates. But please note the authority for APRNs or PAs to have this authority must be delegated by their supervising physician in a protocol agreement for APRNs and a supervisory agreement for the PAs. In this bill, it includes several sections which merely adds APRNs and PAs wherever the code refers to a physician related to signing for home health care or signing death certificates. It also includes sections for Department of Community Health and Department of Public Health dealing with home healthcare services and signing death certificates. The section 7 to 9 includes the language in the code section for APRNs and PAs to add the ability for them to order home healthcare services and sign death certificates, with the ability for APRNs or PAs to have this authority, that it must be delegated by their supervising physician in a protocol agreement for APRNs and a supervisory agreement for the PAs. Also, you will see a few spelling and capital corrections throughout the bill, and there's minor changes to language, just conforming language changes to current code and board policies and procedures. So really, I mean, overall, a very basic bill, but we'll do a lot for the state and helping in our healthcare. With that, I'd like to just let Robin Pinchton, she's a nurse, and just explain a little more of why we do need this. I know on the home healthcare services, we're one of 10 states that do not allow it. And then with the signing of death certificates, we're one of 12 states. So, you know, I think it's time. It's putting patients first and caring about the need that is here in Georgia. But I'll turn it over to Robin to say a few things.
Thank you. My name is Robin Pinchton. I'm a family nurse practitioner for 25 years. I'm CEO and director of a geriatric house call company north of Atlanta, and I'm co-director of the Government Relations Council for United Advanced Practice Registered Nurses of Georgia. As you all know, I stand here to advocate for a pivotal change in the realm of healthcare by the signing of home health certificates by nurse practitioners and PAs, and by signing the death certificates by both nurse practitioners and PAs as allowed by the delegating physician per our collaborative and supervisory agreements. This issue touches upon the very core of patient care, accessibility, and evolving the landscape of healthcare delivery as we navigate through challenges posed by aging population, rising chronic illnesses, and the aftermath of the global healthcare crisis. We have to adapt and optimize our healthcare resources. The CARES Act allowed permanently nurse practitioners and PAs in 2020 to sign home health certificates. All but 10 states did not take that to their state level legislation to change that legislation. Now, I just want you to share some startling statistics with you all. This came from the Georgia Workforce Commission in 2022 and 23. 18 counties in Georgia do not have a family practice physician. 9 counties in Georgia do not have a physician at all. 40 counties do not have internal medicine physicians, and 73 counties in Georgia do not have an ER physician. This is where we can bridge the gap. We have delays in healthcare, and we have both the funeral industry and the home health industry here to explain that further. But we're having delays in cares. Folks are being discharged from the hospital with CHF, diabetes, and home health cannot start care until that order is signed by a physician right now. Nurse practitioners and PAs were allowed to see the patient. We're allowed to write the order, but we cannot sign what's called a face-to-face to authorize that certification. So, primary care in Georgia is collapsing, and delay in signing these two forms is a symptom of a primary care crisis we're facing, and our patients are suffering.
I'll say one last thing before we take some questions. When COVID hit, Governor Kemp signed an executive order allowing APRNs and PAs to be able to sign home healthcare services. And that was in effect until I believe this past April. And I think that just shows right there, they've done a great job. They're trained. They know what they're doing. They have the experience. We have 3 years showing it works. And so I believe right there, it just shows you, I mean, this is a great bill, and it's a bill we need to continue using the APRAs, the APRNs and PAs to sign off on home healthcare services and sign the death certificate. So at this time, I'd be glad to take any questions.
Okay, are there any questions to the presenter? Yep. Representative Petrie.
Thank you, Mr. Chairman. So a few questions, and I begin being supportive, but I have to ask you a few questions. So I was a home care provider for 35 years, as I said earlier. Did a lot of home care. To be helpful to the committee, home care is different than home health. Home health is Medicare reimbursed and is different in Georgia than home care. They're two different things, and I won't get into the detail. But so to begin with, Medicare is a federal program. And if 39 other states are good with this, that suggests there's certainly no federal concern. And I know you made that clear. So that makes sense. So I'll begin there, but I have a few questions for you. So first of all, so when a physician generally orders this care, Medicare is going to provide home care in the home. They're going to be providing therapies, some skilled nursing, probably an aide coming in, all the things that home health does. If a nurse orders that, she's working for that physician, and that seems very appropriate to me. You are talking about a nurse working for the physician that is authorizing care, not for the agency, correct? Just to clarify. Because you work for an agency, is that correct? You work for a home health agency or for a
I'm a
physician?
nurse practitioner working for an independent practice separate from home health agencies.
Okay. all
And
right.
we do have a representative from a home health agency here who can answer questions with that as well.
Well, my understanding, so again, you certainly don't want to have a conflict of interest where, a provider is authorizing services. I want to make that clear to everybody that's here, right?
So,
Does
so
that
what
make
we're
sense?
seeing, what happens quite a bit is if you have a patient who's in a hospital, they're being discharged. The discharge planner coordinates
Okay.
with the discharging physician who will never see that patient again. They're a hospitalist, right? That hospitalist will order home health services. However, he cannot certify what we call a face-to-face and the continuation of care and orders. So that patient is discharged. Remember, we have to make sure that they stay out of the hospital for within 30 days, or the hospital gets dinged. So that physician, they can't get in to see the physician within 7 days, or their nurse practitioner has been following them and has been their primary care provider, and they have been managing these chronic care conditions. We're very able to sign that face-to-face and authorize those orders.
Who does that nurse you're speaking to works for whom? To help
That
me
nurse
understand.
practitioner either works for a clinic, a physician-owned practice,
Right.
their own practice.
Correct.
There's several settings: long-term care, skilled
Sure.
assisted living facilities,
Under the authority of that physician.
through the collaboration of that physician,
Gotcha.
whoever their collaborating physician is. Yes, sir.
Gotcha. Thank you.
Yeah.
Any other questions? Seeing none, we have a number of people signed up to speak to this bill. The first, is it Cy Hum? Would you come forward and speak at the podium mic, please?
Chairman, good afternoon, meeting. My name's Cy Hume. I'm currently the owner and operator of A.S. Turner and Sons Funeral Home in Decatur, Georgia. Billy Mitchell's my representative, if I'm not, unless they've redrawn the lines again. I speak very much in favor of this bill. For the last 5 years, I've been working with Senator Williams. Of course, at that time, he was Representative Williams to speed up the process of death certificates. Representative Mitchell and I have spoken about this in the past. I could go through an entire process of a death certificate with you, but at the end of the day, the biggest problem is the person that suffers the most from a delay in a death certificate is your voters, your taxpayers. And what happens whenever that death certificate is delayed and Social Security is triggered, because we as funeral directors have to enter this through a system now that automatically triggers Social Security, which stops your VA benefits. So recently I spoke with a VA of the veteran, the veteran passed away, the widow benefits stopped. He was 100% disabled, and because she couldn't get a death certificate to the VA in time, it took 9 months to get her VA benefits reinstated. I have seen it now to where back in the day, whenever a widow and widower, either or, mainly the breadwinner of the family was the man, and the lady was the homemaker. The husband set up his accounts to where whenever he brings a death certificate in to the wife brings a death certificate to the financial institution, she can then continue on. I paid her house payment because she could not access her funds. Took 90 days to get a death certificate signed. The person died in a hospital. So by allowing the PAs, the APAs, and the RNs to sign death certificates in certain settings, be it hospice, home health, long-term care, they're already working for a doctor. Oh, and by the way, they can already pronounce a person deceased. So they can already legally say you are deceased. The information is all right there for them to go ahead and fill out a death. Actually, they can do it through the state Gabber system, which is even easier for them. They can designate it to our funeral home. They know who they're calling, or a funeral home. They know who they're calling. They designate it right there. They fill out the information in the death certificate right there. It's 4 steps. And they designate it to the funeral home. We can then do the demographic side. Death certificates back to that family within a week or less, depending on the county. That's a whole other issue. So there's many ways that we can do this. And I fully support this bill.
Thank you. Up next, Carmen, excuse me, are there any questions? No, okay. Up next, is it Carmen? Okay. Diwali, I'm sorry. Your handwriting, it's not bad. I'm sorry.
I'm the stereotype. Thank you for allowing me to speak today. I'm Carmen Cavalli. I'm a surgeon in private practice in Sandy Springs for 22 years. I'm speaking on behalf of the Georgia Alliance for Patient Protection and NAG. This bill has really good intentions, but it has some unintended negative consequences. We all want to increase access to care. What we have is a shortage of home health care workers, not a shortage of physicians to manage home health care patients. This bill does not solve that problem. Patients needing home health care are often chronically ill or managing complex wounds or infections. These patients are already under the care of a physician, given current Georgia law. The language in this bill could remove physicians from the direct care plans of these patients. I see that physicians can delegate to NPs and PAs, but it also says that the NP or PA can develop and order the overall care plans for these patients and be the only one to review the plans every 2 months. This is a step backwards for patients, and it won't increase access to quality care. NPs claim they were doing this work under COVID, under the CARES Act, but physicians were still here during COVID and we're still managing these patients. There is no patient-centered reason to distance physicians now from the care of these patients. GAP and MAG are also concerned about assigning the ability to sign death certificates to non-physicians. Signing a death certificate isn't the hard part. Assigning the correct cause of death is the hard part. My father, for instance, died a few years ago. His immediate cause of death, anybody could have been able to tell. It was a severe infection, sepsis. But the proximal causes are critically important to identify and document. In my dad's case, a bowel perforation during surgery weeks earlier ultimately led to his severe infection and death. Accurate, acute, and proximal causes of death are important to have on the death certificate for medical legal purposes and for insurance purposes. This is also the reason there are delays in completing death certificates. Physicians understand the importance of getting it right, and that's where the responsibility should remain. Please oppose this bill. Thank you.
Thank you. Are there any questions? Okay. Next up, oh, you do? Representative Maziak.
Thank you, sir. I have a question as far, is there a time element that a physician should or may or shall sign the death certificate? Because I hear, and I'm experiencing right now, my patients that are caregivers. And when that death certificate is not signed, how do I say this, in a timely manner, it's just like the gentleman said that he paid a client's house payment because the delay is so arduous. Is there a sunset on there somewhere that a physician has to sign that death certificate, or help me with that?
I'm actually not sure about that, but that would be a better remedy than this particular bill, actually. If there's not a time limit, perhaps there should be. But there are always going to be outliers. As I mentioned, it's not just signing a death certificate. It's assigning accurate, acute, and proximal causes of death. And that could go 4 steps back from what the patient literally died from at that moment. It takes a lot of medical knowledge to dig into that and get it right.
Mr. Chairman, can I have a follow-up?
Go ahead.
Isn't on the death certificate itself, isn't there extenuating causes on the certificate itself? So it would say sepsis, and there would be other circumstances on the certificate.
Yes, and that's what's important to get right, because yes, the patient died of sepsis or an acute MI, whatever it was. But if there are other circumstances that led to that acute termination event, that has to be documented. And that's what I believe often takes time to get right. It's easy to say, yeah, they had a heart attack. It's harder to say, what led to that. That should also be documented.
Thank you. I appreciate that.
Okay. Up next, Lacey Hughes.
Yeah.
I'm sorry, I can't hear you.
To answer her question.
You want to come to the mic? Yeah.
If I might answer the timing question on what a doctor's required, well, is according to the current DPH standards and status is for signing a death certificate. They actually have 72 hours to sign the death certificate. However, there are no teeth or backbone to back that up and to force that to happen. So patients are waiting anywhere from 3 to 4 to 5, 6 weeks in order to get this process completed.
Are you saying that they only have 72 hours to make a determination of death?
Yes, sir. But at the same time, you have to realize that that's in a hospital setting or somebody's being cared for by a physician in a regular setting. If
Right.
that's a medical examiner's case or those are extenuating circumstances that go a little bit further beyond that.
Right. Okay. Question, who we got? Mitchell,
Yes.
Representative Mitchell.
Yeah, to that last speaker, do you have signed death certificates? In your current practice?
I'm sorry, do I sign them?
Yeah, do you?
Well, heavens, I'm a plastic surgeon. I hope not.
Okay. That's it. Yeah. We ready to take a motion, Mr. Chair? Oh, see here, no? Yeah. I think it is convinced the chair. Well, we'll say this is chair. Especially the number of Democrats here, I'm gonna move that bill. I'm going to move that we amend this bill.
Yeah, that's what I thought. You're out of order. Okay,
Oh, Lord.
Sheila Humberstone. Yeah. Do we have a muzzle in the room somewhere? Go
I
ahead,
mean, I hate to
Sheila.
break up this
Yeah, I know.
jovial party that we're having up
Yeah,
here.
yeah.
Mr. Chairman, members of the committee, thank you so much for allowing me to speak to you today. Sheila Humberstone with Stonebridge Consulting here today on behalf of the Georgia Association of Physician Assistants. We want to commend the author for bringing the bill. We know there's a shortage of physicians throughout the state, particularly in rural Georgia, and anything that we can do to allow our advanced practice providers to continue to practice within the bounds of what their collaborating physician authorizes them to do is where we need to be moving. And we think that this bill is a strong step forward in that direction. We are capable of doing this. CMS has changed some of those rules under the CARES Act. And so they said we were capable of this work and we're ready to serve Georgia's population in this way. Thank you so
Okay.
much.
Any questions or comments? Thank you.
Thank you.
Nancy, is it Pilla? Oh, okay. Petra, okay.
Yes, thank you. Nancy Peter with the Alzheimer's Association, Georgia chapter. Thank you, Mr. Chairman and members of the committee. I'll be brief. We are here to say that we support the bill on behalf of all of those individuals living with Alzheimer's and other dementia, and really on behalf of their caregivers, especially in rural areas who are looking for home health to continue to keep their loved ones at home in the care setting that is best for them on their dementia journey. And so we commend the author on the bill. We think this is a great way to extend services to those individuals, especially in the rural areas, within the scope of what they're allowed to do under their physicians now. And happy to take any questions if you have any for me.
Any questions? Thank you.
Thank you.
Okay, is it Tim Davis? GNA? Yeah.
Thank you, Chair. Thank you to the author for sponsoring the bill. My name is Tim Davis. I'm the Senior Director of Government Affairs at the Georgia Nurses Association. Again, we rise in support of this piece of legislation. I think it's important to reiterate the point that Ms. Humberstone made, is that the APRNs still engage in a protocol agreement with their authorizing physician. The authorizing physician has the authority to say whether or not they can or can't do this within that protocol agreement. And so the authority still lies with the physician. And we would ask for your favorable consideration at the appropriate time. Happy to take any questions.
Are there any questions? No, okay. Julie Wyndham.
Good afternoon, Mr. Chairman, members of the committee. I'm Julie Wyndham with Atrium Health, and for the reasons stated here regarding workforce shortage, we support this legislation as well. Thank you, and thank you to the sponsor for bringing it.
Okay, any questions? I have to consider.
But I think there was an interruption, Lacey Hughes.
Oh, okay. Yes, go ahead. I'm sorry.
Hello, my name is Lacey Hughes. Thank you for having me here today. I'm a registered nurse, a practicing registered nurse, and a clinical administrator for a home health care agency in rural Georgia. I'm here to paint a clinical picture why it would be most important for our patients to have this bill passed. We see in home health care, a lot of times patients are discharged from hospitals. They don't have a physician to sign for them for their plan of care. We receive a referral from the hospitals. We cannot initiate that home health referral in a timely fashion. So legally, we should be getting out between 24 and 48 hours. So every day that there's a delay, there are poor patient outcomes. There have been times I've walked in and found a person dead in the home due to delays of getting a physician to sign. The nurse practitioners in rural clinics are seeing these patients. They are alongside with the oversight from a physician. They are diagnosing patients. They are prescribing treatments and medications. They are ordering home health. And all we ask is that you allow these nurse practitioners and PAs to continue to practice in their current scope. We don't want to expand their scope. We just want to be able to take orders and allow our patients access to home health as soon as we can to decrease hospitalization risks, because they're really high. Ours, thankfully, in our area, they're lower because our nurses and our clinicians are bulldogs, and we stay on the phone with our physicians and our nurse practitioners and our PAs. But it's most vital to create access to these homebound patients who can hardly leave the home, to get home health care to come in and bridge the gap and be the in-between between the practitioner and the patient. Thank you.
Thank you, ma'am. Any questions? Okay. This is a very important subject, and we've heard from a lot of the folks here in the room. I've not heard as much from the medical folks as I'd like to, and I think this committee should hear both sides of the issue. I'm not real sure where they are today. So, with that consideration, we will not take a vote today, but the bill is not dead. Okay. We will come back and revisit this legislation at some point before crossover. With that being said, the committee is now finished. Thank you.
Appreciate it, Chairman.
You're welcome. Hold it. We got a presentation. I forgot. Thank you. We sure do. Can you connect? This, if you look at your sheets, this presentation, let me tell you the background for this. And probably a lot of you have been receiving emails from concerned parents about their children receiving medication in school infirmaries. I think part of the issue here is that we have some schools that have their own school nurse, their own clinic, and then we have some schools that are associated with the FQHC off campus. There's been some confusion possibly about what is going on, so we're going to hear from Frontline, a representative from Frontline, and we're going to hear from Matt Cardoza with the Department of Education. We've got this. I can't read that. It's running?
No, he's coming from.
Oh, who is that? I'll tell you. Do we have yeah, go ahead.
Thank you, Mr. Chairman. I apologize about my associate logging off. Let me text him briefly. Also, Matt Cardoza from the Department of Education, who was supposed to be here. He is in a Senate subcommittee, I understand, and so he will be on his way over shortly. But I thank you, Mr. Chairman, for the opportunity to testify. I apologize, I'm out of breath. Was running from another committee that I was just at for testimony as well. But I wanted to take the opportunity. First of all, let me introduce myself. My name is Taylor Hawkins, Director of Advocacy with Frontline Policy Council. Our organization is a large nonprofit Christian ministry focused on protecting family and Christian values in our state. And one of the things that we have seen across the country is a rise in the number of school-based health centers, particularly in the last decade, but starting about 40 years ago. And there's been an increase in those to provide a sort of safety net for students, particularly in low or underserved areas, to offer them services, both the primary care services as well as other services in addition to what they may receive from their primary care physician. And I apologize for interrupting my testimony, but he said he is in the waiting room to testify. So our organization's chief concern, we appreciate the fact that our governor here in the state has allocated a large amount of money to ensure that these school-based health centers can be run efficiently. They can be gotten off the ground, and they can work well to provide good health care for these students. But our chief concern, and which is the genesis of this hearing, is the fact that one of the things we've also seen with school-based health centers across the country is in some cases, they are using blanket consent forms or just not seeking the consent of the parent at all. And so there have been numerous occasions of healthcare, of treatment, of diagnostic tests, of counseling to various degrees provided in different school-based health clinics across the country. And what we've seen is that what's been most helpful is for the legislature in that state to set up essentially guardrails around what will a school-based health center offer.
Now, is this happening? Let me interrupt you. Are we talking about Georgia, or are we talking about just around the country?
We're talking about something we've seen increase across the country.
How about in Georgia?
Now, in Georgia, what we have seen, we don't thankfully have any incidents yet. So I'm proud of that. We haven't had any major incidents that required, legal lawsuits or anything like that. But we have seen consent forms here in the state, and I can provide offline the details on that. Don't want to necessarily call out any school system. But there have been consent forms that are utilized in these circumstances, which essentially, by any good legal interpretation, sign the rights, the decision-making rights, and explicitly says the management of the child's health care with regard to treatment, diagnostic tests, counseling services, et cetera, over to the school-based health center. And they have the ability to make decisions for the child. And we don't believe that conforms to this state's standards of informed consent. Parents should be present for all medical decisions. They should be a part of, they are the sole and chief medical decision maker for their children. And that should be recognized. Again, it is currently recognized in Georgia code, but the lack of clarity around what takes place at schools sort of threatens that. And, I can provide more details if you wish, Mr. Chairman, about some of what we've seen across the country and why we want to prevent that here in Georgia.
Yeah.
But
I'm not interested across country. I'm
yes, sir.
Interested in Georgia.
Absolutely.
So this informed consent, is that occurring in Georgia? Or are parents signing informed consent?
They are, but again, the language of that is very nuanced. And some of these consent forms that, parents get a stack of papers at the beginning of school year, and, you're going through and you're reading, you're doing your best to understand everything you're given. But if it is a requirement for your student to attend school, largely speaking, you're gonna do a quick read and you're gonna sign it and keep moving. And again, it doesn't seem to be a problem until the school-based health center may seek the opportunity to abuse that by offering services or treatment that the parent does not authorize. And again, I'm grateful for the fact, we're very grateful for the fact that we don't have any major examples of that happening in Georgia, but the increase of that is why we came to you, Mr. Chairman, and asked to see if we could clarify the parents' rights in medical decision-making and brought the legislation, which we will hopefully see before this committee before too long.
Yeah, I think we're all interested in parents' rights for a medical treatment of their children. Obviously, children are minors and they cannot sign away any rights. And, the child is the parent's responsibility, and we take that seriously as parents. I know we all do. And these informed consents, can you get the committee some copies of those?
Absolutely.
In Georgia, not
yes,
anywhere
sir.
else?
Yes, sir. Yeah, I have 3 examples specifically. I could get more. And again, grateful that they have not been abused yet, but it should not be the position of a school-based health center to assume the management of a child's health care apart from their parent, even if there has been some sort of consent form signed with regard to that. And my associate from our partner allied organization, Alliance Defending Freedom. They've seen some of this across the country. They've been key in implementing some strong parental rights reforms. And just again, to clarify the position of parents' rights in these circumstances. And another thing I want to mention briefly is that this also protects schools. I think the legislation that you and I have discussed, Mr. Chairman, giving clarity to what is the school's responsibility to seek from the parent, what are the parents' responsibilities, and what are their rights. So if we have the time, I would love to give him a few minutes to talk about that.
Well, you've got a question right now.
Yes, sir.
Representative Petrie.
Yeah, yes, sir, Mr. Chairman, not so much a question, but just a comment. So I think we all agree with, I mean, obviously parents, this is the role of a parent, not government in any way, shape or form. So, but we passed the Parental Bill of Rights just 2 years ago?
We did, yes, sir.
We passed a very strong measure, basically, I think, touching on a lot of this. It would seem to me that would capture this, but.
In a certain sense, it would. And again, our partner there, Matt Sharp, can speak to this a little more. What we're discussing, the language we're discussing, which we hope to see before you, even as early as possibly later today or tomorrow, would not necessarily be a major change to Georgia law, but it would be increased clarity, both in the case of potential lawsuits, which we would then be able to avoid, as well as in the case of clarifying for future school-based health centers, future interactions between parents and children and medical providers as well.
Okay, we've got Matt Sharp up. If we could go ahead and get him on the screen. Lake Media Services is going to do that for us.
I'm on, Mr. Chairman.
Can you say something, Matt?
Yes, I'm on, Mr. Chairman. Can you hear me? Hello, can you hear me? Good afternoon, Mr. Chairman.
Go ahead, Matt.
Oh, thank you, Mr. Chairman. I
Still don't have.
appreciate it. So
Wound up on him, though.
can you hear me okay?
Just say
Testing.
1, 2, 3. When maybe we can
Chest-
find you.
Testing 1, 2, 3. Testing 1, 2, 3. Testing 1, 2, 3. Can you hear me okay? Testing 1, 2, 3. Testing 1, 2, 3. Testing 1, 2, 3. 1, 2, 3. Testing 1. Testing 1, 2, 3. Testing 1, 2, 3.
I think I heard someone on the live stream.
Okay.
I think the
Testing 1, 2,
sound
3.
is coming through the live stream. I'm not sure.
Testing 1, 2, 3.
Go ahead, Matt.
Can you hear me, Mr. Chairman?
Yeah, we can hear you now.
Great. Thank you very much. I appreciate it. As my colleague Taylor said, I'm Matt Sharp. I'm Senior Counsel with Alliance Defending Freedom. We have offices in Lawrenceville and appreciate the opportunity. As he said, one of the things our nonprofit legal organization does is in representing parents, including parents whose rights have been violated. And that includes situation where parents have been denied the opportunity to direct their child's both mental and physical health care. And as you referenced, in 2022, Georgia passed a very good parental rights law, but one of the gaps it specifically left out was in recognizing the right of parents to make medical decisions, including mental health decisions, physical health decisions. And it's something that unfortunately we've seen, and I realize you're wanting Georgia specific, but we've seen how these lack of protections in other states results in these school clinics and others doing, for example, social transitioning, counseling for a child that's treating a female as a male student in other instances. And this is one of the things that we've seen recently, several states enact legislation to fill this gap. So we've got states like Arizona, Florida, Iowa, North Carolina, and others that have all specifically either adopted or amended their existing parental rights laws to specifically recognize the right of parents to make those medical decisions for a child. And these can come up in a variety of circumstances. It can be everything from a parent knowing certain allergies their child has, or perhaps a child is on certain medication and there may be some conflicting medication that if a teacher or school counselor or health clinic provided an ibuprofen. It might create a reaction with something the child's taking. But more broadly, as you and others on the committee have recognized, this is something that we want parents to be involved in. They know their child best, and they're ultimately responsible for guiding them through these medical decisions. And so again, we've seen how in other places where these protections are not there, we've unfortunately seen instances where children have been counseled or provided mental health services or physical health services without parental involvement. And I think we want to make sure that that never happens in Georgia. And as I said, it's simply a matter of ensuring that these protections are there, that the good parental rights law is amended to add these important protections to say, parents, we're going to respect your authority to make these vital medical decisions for your child and make sure that you're in the driver's seat and the state respects your role as the driver of the child's healthcare decisions.
Any questions, comments? Okay. Matt Cordosa, is he still? Thank you. We're looking for the Department of Education, and he is not here to be able to present. So I appreciate you bringing this information. I still
Yes,
would
sir.
like to hear from the Department of Education, hear from the other side of how much this is going on and where it's going on in the state of Georgia. I'm interested in what goes on in other states, but with all the issues we deal with, we really focus on at home in the state of Georgia. And of course, any legislation that may be forthcoming would only apply to the state of Georgia. So that's the reason I made the comment. But thank you
Absolutely.
for coming today, Taylor. I
Yes, sir.
appreciate the information. And we look forward to still pursuing this issue and learning more about it. Okay?
Thank you, Mr. Chairman. Appreciate the opportunity.
Thank you. I want to thank the committee for your time and patience today. And this meeting is now adjourned.